Hello, I'm Dr. Dino Prado, the founder of Envita Medical Centers, and I do work here administratively and with our team. And we're here today with Silvana Smith, who has a pretty neat story. And the whole idea behind her speaking with you today and sharing her story with you is she's a breast cancer survivor, but she used techniques not typical in what people would use in treating breast cancer. So, Silvana, I know you've been through quite a journey, and you're doing great. Mm-hmm. You're in cancer remission, right?
Yes.
All right, now tell us a little bit about how this started. I know you didn't come to Envita right away. You went to other institutions. Tell us a little bit about where you went, what you did, and what brought you here.
Well, I was diagnosed with breast cancer literally by accident. It was prompting to have a biopsy done, even though the doctors had told me that that I had nothing wrong with my breasts, that they were breast cancer free. But I knew that there was something not right, so I requested to have a biopsy done in January this year and found out that I had a 6 centimeter tumor and that it moved to my muscle and then to 21 out of 30 lymph nodes.
And this is January 2010.
Yes. So 3 surgeries later, I had to make a decision on how I was going to treat the cancer because you have to do something with cancer. You just can't do nothing. And so I felt like the surgeries satisfied an important part of the treatment, and then the doctors at the Mayo suggested that I begin chemotherapy for several months, and followed by radiation. And after going through the surgeries, I knew that I couldn't go much lower, and that for me, I'm about 95% sure I wouldn't have survived the chemotherapy and radiation treatment.
Now, you were at the Mayo Clinic. Mm-hmm. What stage would you say your cancer was because they had all that lymph node involvement? What stage would you say?
I think that they moved me from a 2 to a 2-3 when they realized how it had moved.
Okay. And then see, for Envita, that's an early stage cancer compared to this. We see so many stage 4s, but a 2-3 cancer. And so then you decided that the chemotherapy. What scared you about chemotherapy? What was it that deterred you from just doing the conventional chemotherapy?
The quality of life that I've seen through loved ones and through others that they experience as a result of the chemotherapy. That I just didn't believe in my heart that that was the way to approach cancer. That it didn't deal with dormant cancer cells. It just left a lot open, and just intuitively I just knew that this was not going to work for me.
So this is an important point you bring up, because I want to help. Is you were talking about how it doesn't deal with metastases, what we call dormant or active metastases, or the actual spread of the cancer. Mm-hmm. A lot of times chemotherapy might treat the tumor, but it doesn't actually treat dormant or active metastases, which we know that's the function of the immune system to do that. What I want you to kind of share with people is, now you did do chemotherapy here at Envita, right? Yes. But it was very different. Share that with us a little bit.
Oh, it was very different. First of all, the tumor was tested, and I was given a list of cancer or chemo agents that would be effective on my tumor, and I was given a very low dose, I think about 10%. Mm-hmm. And I'm not sure of all the terminology that is involved with this, but I had very little side effect from the procedure, and it was done 3 times a week for a month, and it was, well, I'll back up a little bit. I had a PET scan and a bone scan and blood work done prior to having the chemo treatment that we have here, and I was clean. And that was just from hitting it hard with immune building for 2 months. So that said a lot to me. So when I did the chemo treatment that they do at Envita, it was just an added bonus to where I was at, but I had gotten a clean bill of health before I even did that.
So how did you do through that, what we call here GTF, genetically targeted fractionated chemotherapy, which is kind of like our own version of chemotherapy with genetic testing? How did you do with the treatment? I mean, you came in, you had it. How did you feel after therapy, and how did it work for you?
I didn't feel much different. My stomach was a little. I didn't have the desire for vegetables like I normally have, but that was not a big deal. And you know what, it gave me the comfort of knowing that I didn't completely thumb my nose at the traditional medicine, that I was willing to be open to all the modalities that were out there, and it was my way of being able to make peace with the decision about whether to do chemo or not do chemo. I felt very, very satisfied with my decision, and I would do it again in a heartbeat if God forbid, I was in that situation again.
Now, I know one of the other things you did in therapy here at Envita is, besides doing a fractionated version, or GTF chemo, which is a new version of chemo that we do, you also did something called immunotherapy, where we actually took your natural killer cells in our Mexico Research Center, rebuilt your natural killer cells, grew them into the billions, and returned those into your body as a cancer-fighting agent to go after metastases. Share with us a little bit about that. Now, that's not something you would have been able to get at other cancer centers.
No, it wasn't. And it was, once again, an added benefit to where I was at health-wise. I wanted to give myself the best absolute chance of not only recovering and healing, but not going into remission again. And just, to me, it was just a no-brainer to do this. And the thing about that particular protocol is that, you know, it's the healing is going on in a place where I can't see it, but I really do believe in the immune building and
yeah, the importance of the immune system with cancer. All right, so that's the mechanical stuff. Now tell me a little bit about how did you get, what the strength you had, because I know you and your husband did a lot of praying, you had a lot of spiritual strength for the journey. You guys prayed about a lot of what you were doing. Share with us a little bit, if you would, with the people who are listening today. What could you tell them, if you had anything you want to share with them, the kind of strength it takes, the kind of moral, you know, where did you draw your strengths from to guide you through the decisions you made and the care you received that brought you to the place of healing that you're in now?
Well, I have to tell you that the traditional doctors were all very, very concerned, and I want to say that they put the fear of God in me, that if I didn't do their protocol, then I would not survive 5 years or less. And I just knew that it wasn't going to work for me, that that it took me more, it would have been more courage for me to do it their way than it was to do it the way I did it, because I really believe in this, in the way that I've done it here at Envita. There was another point I was going to make.
Well, what words of courage would you give others, and advice that you give them after all you've been through?
After all I've been through, what I would say is that there's so many decisions to be made, and I wanted to have the inspiration to make the decisions yesterday. And I'll give you an example of one in particular that I agonized over, which was the radiation. And that was something that the doctors put the fear of God in me about, that if I didn't do radiation, it was not going to be a good outcome. And so I was so pleased when I finally knew what I was going to do, and it was a matter of time before I knew it. And I watched another gal who had the same breast cancer that I have, which is a rare breast cancer.
What type was it, if you don't mind sharing?
What type was it?
Was it an intraductal carcinoma? Was it a inflammatory?
I don't remember the terminology. Okay. Yeah.
That's fine. We see many different types of breast cancer here.
It was a rare type of breast cancer that doesn't show up easily on a mammogram, and about less than 10% of women experience it.
Okay.
So, so I watched her. I watched to see how she decided to do the radiation, and I thought, okay, I'm going to be open, because throughout this entire process, I wasn't so stubborn that I wasn't willing to be open to things, but they had to make sense to me. And the radiation, even though I researched it and I talked to so many people to the point of exhaustion, in the final analysis, what came to me was watch the other gal who was close to me in diagnosis and recovery, how she responds to the radiation. And when I saw what happened to her, I knew that I knew what the decision was for me, was to not have the radiation. She was not completely through the whole process of radiation, and she got a staph infection and literally almost died from a staph infection. So that confirmed for me that I wasn't going to do that.
And I think that's important, is that patients need to know they have the options. And if they're empowered and they have access, like you did, to technology from all over the world, not just the limited technology that their doctors are showing them, then they can make those decisions. And so I'm happy that you guys are joining us and you're hearing this story directly from Silvana and what she personally experienced. And the same thing we want to share with you is you have options, and we encourage you to get educated, know what those options are, so that you can make those decisions.